previously on bodies.
Karen, her baby was delivered by cesarean section. He didn't survive.
Will you come and speak to our solicitor?
A patient died because of a mistake that I made. Put me in the witness box. That's the type of doctor they're going to show me to be. Suppose you can't call this a one-night stand anymore.
Don't want to call it anything. I've compiled case studies of Hurley's negligent acts since his appointment.
Why are you conducting a witch hunt against me?
Dr. Orton, would you like to come with us, please?
They've suspended her, haven't they?
Mrs. Drake, possible ectopic. Probably significant internal hemorrhaging.
Oh, shit. Get that. Oh, this isn't working.
You're in my way.
Mr. Whitman, I need you to come to Theatre 12 right away, please.
Is Roger coming in?
I am.
I'm Polly Gray. I'm the registrar on call.
I want a cesarean as the consultant.
He's on call for major emergencies only. I'm covering the labour ward.
I want a cesarean, and I want it now. How many cesareans have you done?
Oh, a few. This is your first pregnancy, Sophie, which means things can take a while.
I want a cesarean now.
But it's going well. You've come this far.
I can't push it out. I can't. Why isn't anyone listening to me?
It may be that the baby's position is making it a little harder than normal. I can use forceps.
No.
We'll give you a spinal anaesthetic. It will be painless. Well, it will hurt a bit when it first goes
I
in.
don't want forceps.
We'll do it in theatre under a spinal anaesthesia.
I want a cesarean now.
A caesarean section is a major operation, not a lifestyle choice. You risk all the complications of surgery. Pain, bleeding, infection, further operations.
We'll sue you. If anything happens to me or my baby, we'll sue you. We'll sue. My husband's a lawyer.
Let's prep for a section. 10 minutes. Okay, thumbs wide. Under pressure, please. That's it. There he comes. There we go. There we are. A lovely baby boy. Really lovely.
Happy birthday.
And hurry up and become a taxpayer and pay for all this.
Mrs. Drake, how are you feeling?
Fine, thank you.
Good.
See? You did the right thing. Hurley was halfway to turfing her to the great outpatients department in the sky.
So it's good news for the patient. Whoopee shit. What about me?
Strong, well, you know that, right? Isn't it? Of course, everybody knew it was his cock-up. I mean, the registrar came rushing in. I swear to you, if it hadn't have been for me... Oh. Hello, Rog.
I thought I was covering the labour ward today.
Yeah, we're just discussing a skaboo admission from yesterday. It's all yours. Oof. Imagine what she's going to be like when she's got a fanny like the Dartford tongue, eh?
Morning. Where's Donna?
Bay 2.
Could you take that for me, please, Kiki? Morning, Roger. How are you?
Well, thank you, Donna. I did check to see how Mrs. Drake's doing.
Oh, the ectopic, yeah, sure. Can you pass me the word book, Kat?
Maya?
Are we a bit early, Roger? I'll just be 5 minutes.
Now, please.
Morning. Anyone in for the round yet?
You see, Mr. Lake, no one thought you were important enough to wait for.
You're late. Do we have her latest blood samples?
They must be in the trolley.
The other ward rounds claimed the trolley.
What other ward round?
So Louise, one day post-hysterectomy, she's complaining of little PV bleeding, but on examination it actually looks like it's PR. There's no chance we've nicked the bowels, no?
Fuck off. And we took her tonsils out while we were at it.
Actually, I thought we'd timetabled our ward rounds so they wouldn't clash.
Got a very, very tricky day.
You've sequestered the notes trolley.
Treasure trove. Now then, Louise, let's find out if you're bleeding for your back passage, shall we?
Well, everything looks good, Mrs. Drake. Had us worried for a while. Glad to see you looking so much better.
Transfused overnight. She's doing well.
Good. Okay. Anyone else we should worry about?
No.
Good, thank you.
We've not really had a chance to talk about what happened in theatre.
It's not so long ago that you botched a crike and I had to cover for you.
You did, and I'm grateful.
Because I thought on this firm we looked out for each other. So what, you're going to management? You handed them one of those pissy yellow forms, yeah?
You're being paranoid.
No, you're being pronoid. You're suffering from the delusion that people are on your side.
Should let that woman die on the operating table. Been a lot less trouble.
So sore.
It's infected. We'll give you an antibiotic and it should clear up in a couple of days.
Hospitals are supposed to be clean.
Where'd you get that idea from? We can't eliminate every source of infection. That's why I warned you it was a possible complication of having a cesarean section.
I'll get this sent off straight away. I need to go to the toilet.
Okay.
I'm just checking your charts, Louise.
This is for my grandson. I've got 8 grandchildren. I had 7 children of my own.
It's good you had hysterectomy. Or your womb might have dropped out of its own accord. Louise Weezer, isn't she one of yours?
Yeah.
Have you seen her labs? Hey, what's so funny? Huh? What?
He thinks you mean her labia. You're a pig.
No. A pig has some virtues. For example, their heart valves can be used for transplants. This is Louise Weezer's results. It's her fecal occult blood.
Shit. Right, I'll talk to the colorectal surgeons. Oh, but she'll need prepping for a colonoscopy. I'm in a hurry.
Polly! Ah, Maya. Would you write up a new drugs chart for one of Polly's? Louise Weezer has just run out. She just needs bendrofluoride for her blood pressure. 2.5 milligrams OD. Polly wants Louise Weezer prepping for colonoscopy. She said it was urgent.
She'll need phosphate enemas then.
Yeah.
Okay, Louise, now just relax, okay? It's all right.
Donna.
Just a minute.
What the hell's going on?
She's having an enema before the colonoscopy.
She doesn't need an enema, just some Picolax sachets.
Kat said the colonoscopy was urgent. Urgent means do an enema.
I never said it was urgent.
Kat said that you had said that you were in a hurry.
She thought I meant in a hurry to prep for the colonoscopy. Shit.
Well?
You keep strum. I'll clear it with the arsehole surgeons and see if they'll cover for us by doing the colonoscopy as urgent.
Okay. My leg hurts. What is it?
It's a blood clot.
My God, what have you done to me?
Any form of surgery carries the risk of deep vein thrombosis. It's a blood clot, not my wristwatch or an undiagnosed twin.
Do you think that helps, being sarcastic?
It helps me. Sophie, what I'm trying to get over to you is that you've had an operation, and no operation, no medical procedure is without risks. It's not like picking up a drive-through McDonald's.
I thought you people got training now in how to talk to patients.
Perhaps we could engage in a therapeutic partnership in order that we might start your treatment.
What treatment?
To dissolve the clot. We'll start you off in injections until we can establish you on a tablet. Warfarin. That thins the blood.
Doesn't sound too bad, I suppose.
You'll have to take it for 6 weeks. And you can't breastfeed.
If it smells like fish and chips, don't worry. It's me putting the vinegar on. Vinegar makes the abnormal tissue appear white. Makes you wonder what they did before colour telly, really, doesn't it?
Hi, Marie. Anything for me?
Yeah, these came from the unit administrator's office.
Dear colleague, reports have been received of golf balls being hit off the roof of the maternity unit. You are reminded that for health and safety reasons, the roof is out of bounds. If the culprit or culprits do not desist at once, disciplinary action should be taken.
The other's just to the consultants, a memo about the waiting list initiative.
Right, good. Thank you.
No patient can wait longer than 12 months for any operation of any type. I've done you and Tony lists of patients who are about to go over the deadline.
Thank you. Has Tony seen this?
I sent his over to colposcopy.
Thanks, Emery. How's it going, Tony?
Oh, you know, Rog. It's just vag after vag.
It's quite. Have you seen the memo about this new waiting list initiative?
Skimmed it.
I've got 1 12-monther on my list. You?
3.
I've got to get them all in this week.
I haven't got the space.
We could try and make space.
Can't.
Why not?
I haven't got the space.
The unit administrator says she'll lose her job if we don't meet it.
The reason I've got those 3 women on a waiting list is because I don't think their problems are particularly urgent. Mick, why should I bust my bollocks so that some management prick can tick a box and then run off to a job at Bupa?
Thanks, Tony.
Candice.
What is it, Tony?
Bloody waiting lists.
Well, the management say you've got to sort it out, Tony.
Can't we, create an unpublished list and put my 12-monthers on that?
What shall I call it?
The, anticipated inpatient list.
No problem. Your waiting list problem is solved.
Jolly good.
Here we are, Louise, nearly back on the ward.
Donna, hi. Have you got a bed available for a waiting list patient?
No, sorry, Roger, no room at the end, nothing.
Polly, Louise Weezer has had her colonoscopy.
So report, sir?
Normal.
Good. Thanks.
I would be grateful if you would see this 39-year-old lady who presented to me in OPD with a red edematous tender vulva. I would be grateful for your dermatological opinion. Yours sincerely, etc., etc.
That was 2 I would be gratefuls.
Really?
Sorry, Tony. Is this another bad time? I was wondering, why don't you come round for dinner this week? Harriet and I have never had you and, You are married, aren't you, Tony?
I don't do dinner, Roger.
Look, I need a favour. One of your charges, Louise Weezer, she's 6 days post-hysterectomy. She had some PR bleeding. Polly turfed her over to the surgeons for a colonoscopy. She bounced back NAD. Just wondering if you could discharge her for me. I need the bed to get one of mine in off the waiting list. I've booked theatre time for tomorrow night.
Whatever.
Thanks, Tony.
Here we are, Louise. Still feeling a bit lightheaded. Okay, I'll say to the doctor and we'll come and check on you a little later, all right?
On their face days. Donna, hi. Can we arrange to send Mrs. Weezer home tonight, please?
Oh, actually, she's complaining of drowsiness and lightheadedness.
Very lightheaded?
No.
Or very drowsy?
Well, no, I suppose not.
Well, she'll be more comfortable at home, and if she's still feeling under the weather, then she can ring her GP in the morning. That's what they're there for.
Doesn't she belong to Mr. Whitman?
Well, he said I could discharge her to make way for my waiting list patient, so can you send her home, please?
Look, I'm not being funny, Roger, but does anyone from Mr. Whitman's firm know that she's not feeling totally all right?
I don't want her falling out, Donna. I'd like her discharged, if you wouldn't mind.
No.
I'll do it myself, then.
Why didn't you back me up?
He's the consultant.
Mrs. Weezer's daughter.
Bay 2, second on the right.
Still feel a bit woozy, Shelley. I'm tired.
Come in.
Mr. Taylor's already arrived. Dr. Alton.
Thank you. Dr. Alton, Annette Prentice.
Pleased to meet you.
You remember Mark Taylor?
Mark.
Hi.
Please sit down. I know this is a distraction, but do you mind if I take notes?
No, not at all.
When we spoke on the telephone, you stated that you were present throughout the caesarean section to deliver baby Daniel Taylor and the subsequent hysterectomy on Karen Taylor.
I was the anaesthetist.
And in your view, Mr. Roger Hurley was negligent in his management of the case?
Patently negligent. He chose the wrong incision. He ruptured a plexus of uterine vessels and procrastinated over the hysterectomy.
And you would be prepared to testify in court to that effect?
Yes, I would.
Dr. Orton, I understand that you're not currently practicing as an anaesthetist.
I'm suspended.
On what grounds?
The hospital have yet to give grounds.
Dr. Orton, I'm sorry, but the hospital say you are not suspended. The reason they give for your absence is indefinite sick leave. I'm sorry, I'm not trying to embarrass you. It's just when I inquired, I received this letter in reply. It was sent to all the staff by the hospital administrator.
This is a lie.
I'm excluded solely and absolutely because I tried to bring to their attention a catalogue of medical errors committed by Roger Hurley.
So you're saying you are not suffering from a psychiatric illness?
Most definitely.
Good. Now, I have to ask you this because it might come up in court. You've never suffered from a psychiatric illness. Dr. Orton, if this is difficult for you...
It is difficult for me. 18 months ago, I had a miscarriage. I was clinically depressed. I had to take time off work. But I got myself back together. And I did my job. I do my job well.
Thank you for your honesty. Thank you.
Hi, Rob. This is Maria Orton. I don't want to stay on this line for too long. Switchboard listening sometimes. I'm outside the hospital. Will you come and speak to me? Rob? Rob, can you hear me? Will you come and speak to me? I know you can back me up in my case against Hurley. If there were two of us with corroborating testimonies.
I'm sorry. I can't help you. I'm sorry.
Hurley is still putting patients' lives at risk. I can't believe you're saying this.
I can't back you up
Why not?
because it'd make me a whistleblower.
The wound broke open because of the infection.
You didn't stitch me up properly.
No, I did, Sophie. The flesh broke, not the stitches.
Well, it's all clean and dressed now. It will heal.
How long will it take?
It could take months.
Months?
I said could. You may need plastic surgery.
Look at me. Look at what you've done to me.
You wanted the cesarean.
I'm going to sue. I am going to sue you.
I warned you of the risks, but you thought you knew better.
I am going to sue you.
You people. You read some piece in a Sunday supplement by some Hampstead bitch. I do this for a living.
There you go. Give it a 4. Cheers. What happened?
We got home all right, but then she threw up and had a fit.
Okay. I'm going to ask you to wait outside if you don't mind. I'm just going to do an examination. Thank you. Stay if you wouldn't mind. I might need to ask you a few questions. Louise and Mr. Lake, I need you to be nice and relaxed. We'll do a couple of little checks on you, okay? Good. Okay. One of the blood tests shows that the sodium level's very low. That'll explain the seizure. Is she on any other kind of medication?
Yeah.
I'll take a look.
These for blood pressure.
Okay, the type of enema we've given her combined with these have probably caused low sodium. I'm going to stop these. I'm gonna have her catheterised and put on restrictive fluids. I'll speak to the medical doctors, and if her sodium levels don't come up overnight, then I'll probably hand her over to them, okay? Any questions?
I could smoke.
You shouldn't smoke, it'll kill you.
You, need a lift?
It's probably just a little infection in your water. I'll talk to the doctors, see what they say. We'll come and check on you later, okay? Morning, Maya.
Good morning.
Louise Weezer was readmitted overnight. She now has a temperature of 37.5. She was catheterised, so it's probably a UTI. I've taken a CSU for her.
Oh, thanks. I'll get it off. Oh, I may as well write her up for an antibiotic now.
This is Lillian Edwards. She's for admission.
Does she belong to us?
She's been called in from the waiting list.
Oh,
You're whistling again, Lillian. You are whistling.
Look, I'll sort this out. We'll put you in the day room for now, Lillian, all right? Can you pop it in for me, please? Thanks.
Is my TCI in?
Lillian Edwards? I don't have a bed for her.
But I had Louise Weezer discharged last night to create a bed.
Yeah, the patient bounced.
Oh.
Oh,
Have you got any other TCIs today?
there's a lady coming in for a prolapse repair.
Okay, phone her, cancel her, and give her bed to Mrs. Edwards.
The prolapse has been waiting 11 months.
Donna, please, cancel her.
So, Roger, if I cancel her operation, it's not long before she's at the 12-month deadline.
Well, it's a month.
So what do they want us to do then?
Well, that's next month.
But if every month you keep having to cancel one lot of patients to bring another lot in, then you're never going to... Sorry. What was I thinking of?
Mrs. Drake, HB Holding, no problems.
Good. Excellent. Home, then. I should take an early look to ensure that everything remains well. We can do that as a day case. Someone go and see what she wants. Rob? We'll be all right without you.
I gave Louise her first dose of penicillin. I think she's having a reaction.
Yeah, that's a reaction. Forget about that.
Can we lay her flat?
Leave it to me. Get me the adrenaline. 1 mil of 1 in 1,000. 200 of hydrocortisone. 10 of chlorpheniramine. 5 milligrams of salbutamol to be nebulized. And gelifusing on standby. Louise, you're gonna be fine. This type of thing happens all the time.
Isn't this the lady I had discharged?
Yeah. Shit.
Okay, someone get me an ambu bag and a Goodell airway right away. Put out a 2222 respiratory arrest. She needs to be intubated.
Do you want to do it? Still got a pulse. Ish.
Still got an output.
Your anaesthetist being fast bleeding.
I'll back her while you set up to intubate.
Okay, someone get the jello running, please.
Yep.
Well, what's happened?
No idea.
Maya?
Not sure.
No output. Start compression flow.
Okay, get me an adrenaline shot. Where's the anaesthetist? Cat?
I'll get
Bring her notes.
Okay, I'm going to try intubating her before the laryngeal edema gets any worse. She's too swollen. Maya, stop for a second. Maybe I could... Shit, no. I need a narrower tube.
Donna, get onto the theatre, get a narrower tube. Where's that bloody anaesthetist?
What do you prescribe her?
Amoxicillin, 500 milligrams IV.
She must be allergic to penicillin.
I don't know.
Chest compressions. Chest compressions.
What are you doing in there? It's this one. For sake.
I don't know.
Standing outside.
I'm sorry, but I went to the wrong ward. I'm still new.
Come on.
Maybe we should try shocking her.
It's not part of the assisted protocol. Tube.
Not going to make much difference.
Any idea what happened?
Thank you.
No.
Okay, stop for a moment, man. Oh, shit.
She's not breathing on her own.
Shit.
What's happening now?
She's still not breathing for herself. They're ventilating her and they're going to take her down to ITU. You admitted it to anyone yet?
No.
Written up any notes? Keep it to yourself. I'm going to buff the notes.
Rob.
Someone should have realised before a prescription was carried out. It's not just your fault. Christ almighty. She should never have been discharged last night. Would have picked up on the low sodium and she'd be home by now watching telly with a cup of tea.
If it isn't my fault, whose is it?
Give me a bleep and go home.
What about work?
I'll be fine. Especially now we've got one less patient to worry about. Give me a bleep.
fill out a clinical incident form.
Must be joking. Look at the state of her. But do you want to own up to that?
Christ, no.
What's she in for, anyway?
Hysterectomy.
Jesus Christ. Don't you just love hospitals? Comes in to get a dry old bits locked out. After all the cock-ups, it's a UTI that does her.
From UTI to ITU. Palindromic referral.
ITU. They used to call it intensive care, until they realised nobody did.
Have you, have you off the notes?
Only had entry for anaphylactic shock, severe laryngeal edema, every bit bad luck during the resuscitation, our heroic efforts. Not so much about the fact she was given the wrong bloody antibiotic.
Relatives next.
I can talk to her if you want. I've spoken to her before.
Okay.
This is the consultant, Mr. Hurley.
Hi. Thank you for coming in so quickly. I'm really very sorry about what's happened.
Your mum develops an infection in her water. This often happens when a patient's been catheterised. It was absolutely essential that we gave her the strongest antibiotic available. For some reason that we're still investigating, her allergy to penicillin was not recorded on the drug chart.
But why didn't anyone know about her mum being allergic to penicillin?
Well, we've started an urgent investigation. It may be that your mum forgot to mention her allergy, or that it wasn't recorded by the doctor that admitted her for the hysterectomy, or that the pharmacist didn't label her drug chart. There are so many steps involved with something as simple as giving a patient the medication. It's just too early to decide what precisely went wrong. Needless to say, as soon as we've got more of an idea, we'll be completely open about it with you.
Was this something that wouldn't have happened if she hadn't been sent home?
She would have needed the antibiotics anyway.
Can we see her at all? I'll phone the ITU and find out when would be a good time for you. Thanks.
I'm really very sorry.
Thanks.
What a total sodding balls up.
Should be a couple of minutes.
Okay.
So, we're entitled to an explanation.
That woman, you get involved in her discharge, the next thing she ends up in a cabbage patch.
You know how much pressure I was under to get that patient in off my waiting list?
Oh, yeah, that's right. This is also that you get to fix some old dear's vag, not that she actually uses it anymore. Tell you one thing, Rog. She will not appear in my figures. No bloody way.
I know he's not strictly yours, but he's been quite emotional. I can get hold of you. It's just through here. He's PFO, possible PGT, PDE. Found outside the Plough and Harrow.
Where's the Plough and Harrow?
You really should get out more.
Come on, Mark. Let's get you up. Thanks. I'll take you from here.
OK, if you need any help, I'll just be outside. Cheers.
What's PFO?
Pissed, fell over. PGT, piss got thumped. PDE, pissed, denies everything. What happened tonight, Mark?
Don't know. Don't remember. Fancied a couple of pints just to get out of the house.
How are things at home?
She cries. She wets herself. She shits herself. It would have been better if she'd died. I miss my boy. I only had him for a few minutes. He was taken away because I'd loved him too much.
Why did you let Early do this to me?
Why won't you help us? Why?
As you know, Mr. Lake, Karen Taylor's medical notes aren't available to us. The hospital maintains they've been lost. We need testimony from someone who witnessed what happened to Karen Taylor in that operating theatre. Dr. Orton is prepared to testify, but with the hospital endeavouring to discredit her, we need corroboration. If you backed up her account of Mr. Hurley's negligence, we'd have a case. A strong case.
I corroborate her account.
Great. And you testify to that effect. Mr. Lake, you could come in here and tell me that Roger Hurley is Jack the Ripper, but it cuts no ice if you're not prepared to stand by it in court.
I just want Mark and Karen to get the compensation they deserve.
A patient harmed by medical action isn't automatically entitled to damages. We have to prove negligence in order for Karen and Mark to secure damages. Well, you understand that, don't you?
Yeah, of course.
Look, Ro, it's about more than that. I want Hurley to look me in the eye, admit what he did to Karen and say he's sorry. And for that, we need you to stand up and say what he did. Please.
Second on the list.
Sorry, what is it?
The ovarian carcinoma. It's part of a series I'm putting together, hoping to publish it in the spring.
Boss, Mark Taylor came into casualty last night.
How is he?
Not very good. You can imagine.
Yes.
You probably don't know this, but Karen's notes have been lost. They're having a hell of a battle trying to get the hospital to listen to their claim for compensation. The money would make such a difference to them.
How do you know all this?
Just one of the nurses. I think she knows their health visitor.
Well, it's down to the hospital to deal with any claims for compensation.
Well, maybe we could help.
No?
By not contesting their claim.
As I just said, it's down to the hospital, not us.
You could go to management, boss. Say they deserve the compensation.
So I go to management, or you do?
No, of course not.
Well, I can't go to management. You know how fickle they can be. Today I'm the blue-eyed boy, getting the hospital's name in all those learned journals. Tomorrow I'm going to the tabloids.
What if we just admitted something went wrong? Look, I'm sorry to bang on about it, boss, but what if we just admitted something went wrong? Just so they could get their compensation and start putting their lives back together again.
Look, I'm as altruistic as the next chap. I'm not going to confess to something I'm not to blame for.
You were to blame. Mr. Whitman, I need to talk to you for a second. Things may be about to start to get difficult for me around here. You know about Roger. If you back me up as principal consultant, then...
Didn't you have a problem a while back? Kill somebody?
Yes.
People cover for you?
Yes.
Yeah, well, it's the same system that protects you, me, Roger, all of us. For the most part, it stops good doctors' careers being ruined by isolated, uncharacteristic human error. But occasionally, it goes wrong, and we end up inadvertently protecting people like Roger Hurley. But it's the system, and it's there for a reason. Reject it, and you're on your own. You're a management poodle. A poodle pulling a little gay trolley.
See those adhesions?
Yeah.
What do you think they are?
Give in.
Endometriosis.
I'm normally in on the lap list.
Maya, fancy to go. There's bits and bobs on the ward. You take care of them for us, would you? Now, where's he going?
Towards Maya's patch.
Maya, will you close, please?
Close?
You're here to be trained. I can't train you if you don't respect me or my ability. I can't trust you anymore, Rob. You went to Whitman. What's to say you won't go to management?
I'm not going to go to management. What's between doctors stays between doctors.
Trust is reciprocal, Rob. Maybe now you'll understand the damage you've done.
Oh, it just caught me, Tony. If you're not going to be long, I could hold on for a lift.
I'll probably, be a while, I think.
Right. Turn the lights out when you go.
Hiya.
Sorry. The port ran over.
How long can you stay?
Half an hour. You okay?
Yeah.
Yeah. Do you want to spend this time talking?
No. I don't want to spend this time talking. Well, only half an hour.
He's waiting for me. I phoned from the pub. He's booked a restaurant. Oh. I don't want to go.
Well, then don't.
I have to.
I want you to smell of me.
Hurley must have gone to management. They're calling me in. I'll fight. They won't win.
Certainly, madam. Just bring your details up now. That's no problem. Just bear with me 1 second. Thank you.
I'll have to see if I can fit that in. Can you arrange for Thursday? No, afternoon.
Mr. Lake.
Thank you.
Right, I'll speak to you soon. Bye. Have a seat, Mr. Lake. Would you like a cup of coffee?
No, thank you.
I asked the managers if this meeting could be just between doctors, but we're waiting for Mr. Whitman, but I don't think he's going to turn up, so I think we should start. I should begin with an admission of my own guilt. When you've got a new registrar, it's not unusual for them to have a bit of a rocky start, so you want to give them a bit of time to settle in. I now recognize that this is a problem I should have nipped in the bud because it isn't going to go away. We've just received a verbal deposition from a member of the nursing staff corroborating information in the case of a patient of ours, Mrs. Angela Strawberry, who died following an unsuccessful attempt at a surgical cricothyrotomy.
I thought this was going to be about the Taylors. Their baby was stillborn and Karen Taylor suffered brain damage during the operation trying to deliver him.
This is about Angela Strawberry. This is about you, Rob. Now, in a case like this, there isn't an established protocol to follow.
Hold on, Roger. I played the game here. I have not blown the whistle.
As Mr. Hurley said, there isn't an established protocol to follow in a case like this. Have you anything to say regarding your management of Mrs. Strawberry?
Angela Strawberry was a one-off. Since I've been at the hospital, there have been more than the Taylors. Louise Weezer, Mr. Hurley sending her home early, that was not a one-off. Mrs. Drake, me having to call him Mr. Whitman during the operation, was not a one-off. Look, this is really nothing personal. I just don't think you're as good a surgeon as you ought to be. If I'm not close enough to judge that, then who is?
The case we're dealing with is yours, Rob. Your negligence, not mine. And we've all been trying to tell you there isn't an established protocol for this. So I've proposed that you be put on extraordinary leave from my firm, pending an inquiry.
What if I refuse?
Then we'll suspend you.
Are you accepting the leave?
Thank you, Mr. Lane.
Thank you. Oh, I'll get the forms with you.
Great, thank you.
I'll resign. I'll sign anything you want, binding me not to talk about you, this situation, the trust. Just let me move on.
I'm afraid it's not down to me. The details of your case will be passed on to the postgraduate dean. Possibly you'll be held back a year or two, or in time moved to a less responsible post.
It's you this should be happening to, Roger. Not me.
No, Rob, it is you. You're just not as good a surgeon as you ought to be. And if I'm not close enough to judge, then who is?
Don't you want my badge and gun as well? Like in those American cop shows.
You know where the guy gets suspended?
Taking you off the bronchitis case.
Well, I've been working on the Bronx for 5 years.
It's worse with the nurses. They usually cry.
Next time on Bodies.
I'm prepared to testify against Mr. Hurley on behalf of the Taylors.
I want you to look me in the eye, hold up your hand, and admit what you did to us.
I was not negligent.
How can you keep on denying what's happening in this hospital?
Something is going to happen to that baby, and something is going to happen to that mum.
Come on, then. Big push-up. I need you to help me. There may be a way that I can get my job back.